And welcome back. Our next guest is a board certified psychotherapist, education advocate, author, mental health clinician, and the publisher, executive director, and owner of the New York Trend newspaper. She joins us to discuss the importance of elevating awareness around mental health in Black and Brown communities and shares tips on how adults and children can navigate trauma and anxiety in their daily lives. Please welcome to the show Dr. Teresa Taylor Williams. Doctor, welcome.
Good morning, Bob.
How are you?
I'm very good. How are you?
Listen, thank you for all you do in creating this awareness. Um, there are a lot of people in our community dealing with different situations. They come up to me. I mean, I'm Dr. Bobley, but I'm not a psychotherapist or anything like that. But they still want to find out how they can overcome certain situations. Um, but there's that stigma. A lot of people don't want to mention it or talk about it. But you can see that there's a lot going on in our community and in our world.
There really is. You know, mental illness and mental health challenges in our community is so prominent. But one of the problems is that there's such a stigma still attached to recognizing that there's something wrong.
Yeah.
Um, you know, I always tell people that we need to treat the brain just like we treat any other part of our body. So, for example, if you fall and break your knee, or you fracture your hip, or you break your ankle, we're going to know it because you're going to have a cast and you're going to have a crutch.
Yes.
It's visible pain
Yes.
and it's visible suffering. But for mental health, we can mask it so greatly, especially people in our community, Bob, because we have a history of hiding our feelings and our emotions. We trudge through the day, we put our mask on, and we put that armor on
Yeah.
and that smile, and we say, we're just going to make it and do what we have to do each day. But inside, we're suffering.
Yeah. And that's what we were talking about when we were dealing with people who were oh so happy and jumping on stage and performing. And you don't know what's going on backstage in their
Mhm.
lives. Like Phyllis Hyman, you know,
Mm.
we were just talking to her a couple of days before she did what she did to commit suicide. But we didn't think that she had a serious problem or something was bothering her. And there are a
Mhm.
lot of people out there like that. How do you address that? What do you say to people who would think that, you know, I have this problem. I don't want to let anybody know about it, but I'm going to end it all. I want to deal with this anymore.
Well, first of all, I was such a fan of Phyllis Hyman. My husband introduced me to her
Yeah.
music, and such an amazing performer. She looked like she was on top of the world.
Yeah.
Seeing her on Broadway, she was tall, statuesque, beautiful, amazing
Strong.
voice.
I remember her picking Vaughn Harper up on stage.
Oh my Well, I'm a student of WBLS.
Yeah.
So,
Thank you.
to see Vaughn and to even listen to you and all you do a lot for mental health, going to schools, speaking to young people. And so we look at people like Phyllis Hyman, someone like Phyllis Hyman, and say, how could she have done that?
Yeah.
But let me explain this in how that can happen sometimes. You know, like I said, we put this mask on, we have responsibilities, but we are hurting. And the hurt is so painful that the brain just says, I don't care what you do, just stop the pain.
Yeah. Yeah.
And so when we are suffering and we're in pain and we're in mental pain, and we really feel like there's hopelessness, there's no way out of this situation, I don't know how to fix it because we look to ourselves to help ourselves. What we hopefully can do before we get to a point like Phyllis is to realize that we need a partner. We need someone to talk
Someone
to.
to talk to. Yeah.
And it doesn't have to be someone like me. It could be a friend, it could be clergy, it could be, a parent, a relative.
Yeah.
You have to have a partner in this because life is tough
It is. It is.
and it's very hard to navigate by yourself.
So you can become an honorary psychotherapist, by just lending an ear and letting people just they'll open up to you. They may go but so far, but as they get used to you, they may open up and say, "Hey, you know what? This sucks.
Yeah.
I'm going through this and that." And you may be that person. You may be that person. But how does your role as a professor of psychology inform your clinical practice with adolescents and families?
Well, first, I in my with my students, um, you know, talking to future psychologists is exciting, it's rewarding, especially seeing young people of color who really want to go back into our communities
Yeah,
and establish their practices there. But I do say to them that this is not for the weak of heart. It's not like TV psychology.
yeah,
You are going to be dealing with some real issues, and you have to be well prepared to serve that population. When I talk to students and with students and young people I have in my practice, most of the times they're coming to me because of anxiety. And, statistically, anxiety is one of the highest emotions that we are suffering from right now,
yeah,
especially due to so many challenges that are facing everyone, but specifically us in the Black community. And so I tell students and young people that you have to hold on to the fact that this too will pass and
yeah,
you will get better if we follow a
mm,
program and we have the support of your parents and your teachers.
yeah.
You're going to be okay.
And doctor, anxiety has a look of many different diseases out there. It can make you think you have high pressure, heart trouble, stomach problems. And sometimes people go to the doctor, and the doctor will examine them, and they say, "No, you're okay. What's bothering you? What's bothering you?"
Yeah. You
And
know,
they'll send them to somebody else, and like you, who can maybe get into their mind.
well, first of all, you're so right about how anxiety and also depression presents. We look at the pathology of what's going on with this individual. And
Yeah,
in that pathology, there may be high blood pressure, there may be stomach issues, there may be, circulatory issues that they're suffering from because, it's something called somatic syndrome where your mental issues start to present physically. So you may have
yeah,
aches and pains, you may have muscular issues, but then you go to the doctor and the doctor says, I think you're fine physically. What
yeah,
else is happening? And with this somatic syndrome, it can make you feel like you are actually suffering from that disease, but you don't have it. But you are suffering from anxiety. You could be suffering from trauma, secondary trauma, post traumatic stress disorder, which used to be just relegated to people who went to war. But there are so many factors that can contribute to your overall health, but then your overall suffering. And
yeah,
so you should start with your general doctor and then allow your doctor to send you to someone like me. But you know what? The thing we don't want to hear when we go to the doctor is you need to go see a psychologist. So you need to go,
yeah,
see a psychiatrist and get some meds.
yeah.
That's like, oh no, I'm stopping it here.
You can't even go home when they ask you what did the doctor say? You
You
say,
don't know where you are.
he said I'm all right.
Yeah. Yeah. And so, we turn away from treating it. But the good news is, if you will take that leap, if you will get a partner, if you will face the fact that you might have a mental health diagnosis, you can get better and you can live an absolutely normal life with
Yeah.
treatment, medication, and support.
Doctor, you have a classroom full of students, um, and what doctors go or students go who are involved in this? How do we get help? Where do we go?
Well, that's a great
We have to
question.
see someone.
Well, but you know what? Because of state mandates, we are supposed to, as clinicians, have our own mental health, uh, person,
Mhm.
psychologist or psychotherapist that we check in with once in a while. And I absolutely do that. I have a colleague that we will make time to have lunch, meet for coffee, because we have to also check in on ourselves and even share some of the things that we are facing with our patients,
Yeah, yeah.
you know?
Because sometimes if you can't help them and it gets really, really deep, you may want to send them, hey, maybe somebody that's been in this for 50 years or 30 years or 20 years can do.
I I always use a colleague. I have a very good colleague that we will collaborate on cases, because I'm not perfect in this role, and there are other colleagues that are more seasoned than I am in certain
Mhm.
areas, and certainly have other specialties where I feel
Yeah.
that I am not fully equipped to handle it.
Tell us about the newspaper, the trend.
So, New York Trend was started 30 plus years ago
All right.
because I was a student of journalism. I,
Oh, okay.
yes, and I started New York Trend after I had the opportunity to work at a newspaper, a historically Black newspaper called the New York Voice,
Yeah.
out of Queens. The publisher was Ken Drew, an owner. And I met so many people who I just looked at them in awe, mostly Black men who I saw as a success in this industry. But I was always a writer. And once I left, I felt that I could produce something with a new generation. And so I gathered a couple of journalists, young Black journalists. We started an internship program, and New York Trend got off the ground.
Wow.
One of my first and most solid advertisers, you mentioned in another interview, was the Honorable Percy Sutton
Oh my God.
of
Yes.
Inner City Broadcasting.
Yes.
And I have to tell you, Bob, meeting him and spending time with
Wow.
him when he started Quix Cable, the first Black cable company. Um, was just amazing. It has been impactful in my life.
Yeah.
I got to talk to him about entrepreneurship and always having multiple businesses. And I don't know if you could tell with all the titles under my name that I follow that. I work about 5 different jobs.
And you're not Jamaican.
And I'm not Jamaican, but listen, he was an advocate of,
I'm an honorary Jamaican. I have about four
okay,
or five different.
listen, you have to have multiple sources of income.
Yes. Yes.
But you have to treat people right, and
Yeah.
then you will get the support, and that's what I learned from him too. He Anybody that came up to him, he shook their hand. He
Yes.
spent time talking to them.
Exactly.
I looked at him, I was at that time very young, but in this newspaper business, and he said to me to just always demand respect.
Yes. And
Always
they're gonna
demand
wrap
respect.
me up there in my ear telling me I got a hard rap. But I wanna let you know that, I worked with Persis, I worked with him for many, many years, and he told me to stick with whatever I do. Um, I wrote for my school newspaper, New York Institute of Technology, and also, briefly for the Amsterdam News, brought pictures up there and did the stories behind them. And,
Mhm.
I have my 7th book out. This
Wow.
is the 4th of People to Know in Black History and Beyond. I don't
Congratulations.
want to promote it, but I just want to let you know this is for, and just from a shy person to putting the things out there. But we'll talk more, okay?
Alright.
Give me a social media where people can reach you and find out more.
You can reach me on Instagram at Dr. Teresa Taylor Williams. You can also reach me on other social media branches by going to drteresataylorwilliams.com. For New York Trend, it is newyorktrendnyc.com. And I am also on part of Psychology Today. So if you just Google that, I come up.
Tracy, nice talking to you, and come back again, okay?
All right. Thank you very much.
Thank you. We'll talk more. I will
Bye-bye.
take a quick break. I've got more open. We're hanging out right here on 107.5 WBLS and open. We appreciate you.